People in the healthcare field have high health risks, and they have the duty to care and to advocate for a healthy lifestyle. It's important for healthcare workers to ensure that they are in excellent health, and excellent health comes from healthy behaviors. Last October 2018, our team conducted a survey regarding physical activities and nutrition of healthcare providers and professionals in Nevada. The purpose of this study is to see if healthcare providers and professionals practice better health behaviors in comparison to the general population.
Do they practice what they preach? To find out, we used 9 tested survey questions from CDC's Behavioral Risk Factor Surveillance System. In case you're wondering, what is the Behavioral Risk Factor Surveillance System? It is a nationwide telephone survey conducted every year since 1984 regarding the people's health-related risk behaviors, chronic health conditions, and use of preventive services. Then, they use the gathered data to build health promotion activities.
In our survey, we included demographic data, sex, age, race, ethnicity, marital status level of education, weight, and area of occupation. The team collected contact information of 4 colleges, 3 universities through their respective institution websites, and we yield a total of 655 possible survey participants. The 9 survey questions from the BRFSS was transcribed to an online survey tool. We used Google Forms and then sent an email that directs a participant to the online survey. Out of 655 people we emailed, only 102 responded.
So moving on to the next best part of our study is our data. So the first 3 questions are about physical activities and exercise. And the first question is, we asked if during the past month, did our healthcare professionals and providers participate in any physical activities or exercises such as running, calisthenics, golf, gardening, biking, or walking for exercise. As you can see, only 19 people said no. More than majority of them said yes, so it's good that they're exercising. And for our second question about physical activity, we asked, how many times per week do you take part in an aerobic activity for at least 10 minutes? Let's look at the data. 14 people said once a week. 8 people said twice a week. 51 people said thrice or more per week. And 24 people said they don't. And 4 people said that they're not sure. And for our third question, we asked how many times per week did our healthcare providers and professionals exercise to strengthen their muscles. Okay, and here is the data. 13 people said once a week. 16 people said twice a week. And 32 people said 3 or more times per week. But 37 of them said that they don't exercise to strengthen their muscle. After the 3 questions about physical activities, the following 6 questions are going to be about our healthcare providers and professionals' dietary habits. And for the 4th question, we asked about how many times per week did they drink 100% pure fruit juices. This is not to include any artificially flavored drinks, but are pure juices like orange, mango, pineapple, apple, grape, or grapefruit. Okay, and look at the numbers here. 11 people said that they drink pure fruit juices once a week. 20 people said 3 or more times per week. And unfortunately, 62 of them said that they don't drink pure fruit juices. Next question, we asked how many times per week did our healthcare providers and professionals eat fruit. Okay, so this is not to include the juice that they just mentioned earlier, and also not including jam or jelly, fruit preserves, fresh, frozen, or canned food, or anything like that. Okay, so let's see here. 75% of them said that they eat fruit 3 or more times per week. 12 people said twice a week. And 7 people said once a week. And only 3 of them said that they hadn't eaten fruit for the past week. Okay. Okay, so for the next question, we asked, how many times per week did you eat cooked or canned beans, such as refried, baked, black garbanzo beans, beans and soup, soybeans, edamame, tofu, lentils, and beans or veggie burgers? So let's look at the numbers here. So 28% of them said once a week, 13% of them said twice a week, 24% of them said they hadn't eaten any beans for the past month, and then 32% of them said 3 or more times per week, and 3 of them said they wasn't sure. And for the next question, we asked, how many times per week did you eat dark green vegetables such as broccoli or dark leafy greens including romaine, chard, arugula, kale, collard greens, or spinach? Okay, we said not to include iceberg lettuce. Okay, so let's look at the actual numbers here. So beginning for once a week, 17 people, and 14 people said twice a week, and then 6 to 5% said 3 or more times per week. That's really good. And 3 of them said they had not eaten dark leafy greens. So for the 8th question, we asked, how many times per week did you eat orange colored vegetables such as carrots, pumpkin, sweet potatoes, winter squash, or carrots? So only 13 of them said they had not eaten orange colored vegetables. 22 people said they had eaten orange colored vegetables once a week. 31 people said twice a week. And then 31 people said 3 or more times per week. And then 4 of them said that they wasn't sure. Last question for our survey is, during the past month, how many times per week did you eat other vegetables? Examples of other vegetables include tomatoes, tomato juice or V8 juice, corn, eggplant, peas, lettuce, cabbage, okra, mushrooms, peas, jicama, oriental cucumber, and white potatoes that are not fried, such as baked or mashed potatoes. So let's see here. 7 people said once a week, 18 people said twice a week, and 71 people said 3 or more times per week, and only 3 said that they had not eaten other vegetables for this past month.
Here are the demographics. About 79 out of 102 respondents are female. 52 of 102 respondents are aged over 31 to 50 years old. 30 of them are aged 51 to 64. 14 of them are 65 and over, and 6 of them are 19 to 30 years old. 67% were Caucasians.
71% of them were married, 10% were divorced, and 11% of them were single, and 97% of them have 4 years of college or higher.
23% of them weighed 161 to 180 pounds. 18% weighed 141 to 160 pounds. 19% weighed 121 to 140 pounds. 14% weighed 201 to 250 pounds. 15% weighed 181 to 200 pounds. 68% of them have been to a doctor or nurse or health professional during the past 12 months. 13% are clinicians. 38% are physicians and nurses. Using the chi-squared analysis method, it was revealed that the healthcare providers and professionals do have better health behaviors at the P less than 0.05 level.